Parents come with the concerns about their child's development and behaviors, and I know it's something that is very worrisome to them. Today we're going to discuss about autism in children. Hello everyone, this is Kids Corners with Dr. Ife and Dr. Esome Former, and I'm here to walk this path of motherhood with you. Come with all your questions and I'll be glad to answer them. If you haven't subscribed to my YouTube channel, please do so. Subscribe, like and share. Today we're diving into an important topic, which is autism. What is autism? Autism is a neurodevelopmental problem that we see in children. It's a spectrum of disorders that range from mild to severe form of disorder, and also you have varying level of intelligence, meaning that these children might also be very intelligent despite being an autistic child. So it's not a dead end for mothers. I know it can be something that is so disturbing, but that your child is autistic doesn't mean that the child can still not achieve what he wants to achieve. We've had autistic celebrities that are great people today. Autistic children have problems with social interaction, communication, and they have a particular way of behaving. These signs are subtle during infancy, but between the ages of 2 to 4, it manifests, it becomes more obvious. A lot of things have been linked, factors have been linked to this. First is genetic factor, environmental factor like heavy metals, toxins, and also problem during pregnancy. Maybe the mother have an advanced age, premature delivery, and other problems during pregnancy in mothers. Also, biological factors also have been linked in autistic children or in autism. The thing about autism is early identification and presentation is very important because it will help us to start therapy on time. What are the signs? First is they have problem with social interaction. So autistic child do not have proper eye contact. When you look at them, they usually shy away or look down, and you might think that there is a problem or the child is shy. No, it is one of the earliest signs of autism. Infants can communicate with you using their eye. There's something we call social smiles. During that time, they can smile back at you as you smile with them. So they usually have very proper communication using the eyes. Even toddlers, they express themselves. They communicate very well with using their eye. They can look at you to show you they're excited, or they can drag you and show you something, point directly to something, a toy or that they like. Another one is autistic children cannot use gestures. They don't know how to use gestures to communicate or show concern. Like when they're eating and you're forcing them to eat, they know how to say no by shaking their head, or they can nod their head in agreement with you, or when they see you, even if they cannot talk, they know how to extend their hand and express excitement or ask you to carry them. They know how to wave bye-bye, so they can use gestures to communicate, and they can also understand gestures you give them as mothers. Another problem they also have is they don't respond to calls. When you call them, they don't respond to you. When you call them, they just pretend that they're not hearing. Another point is pretend play. They don't know how to pretend to play. Normal child should be able to play with toys appropriately. Like a girl can be able to know that they can feed their doll baby. You can see a girl feeding their doll baby. You can see them pretending to cook. Then for the guys, when they see car, they can be able to pretend to drive the car by making some sounds like "voo." They know they have to drive the car. Or if they have an aeroplane, they're able to pretend to fly the aeroplane in the air. So they know how to pretend to play. Another one is copying actions from their mothers. A normal child will be able to copy actions. When the mother is combing the hair or when the mother is sweeping, they want to imitate whatever the mother is doing. So that is another way for a normal child. So for language, they don't know how to use words. They don't make appropriate words for their age. Like a toddler should be able to make 10 to 15 words, like apart from calling their daddy or their mommy, they can be able to say football, they'll be able to say bag. And for the older children, for preschool or school age, like 3 to 4 years, they'll be able to make sentence using 2 to 3 words. They'll be able to say, I want tea, daddy come, let's go. You know, they'll be able to say this word, but in them, they're not able to make these words. Another one is they have a particular way of behaving. they can continuously nod their head, they can flap their hand, they can stamp their feet. They have just a weird kind of behavior in them that you'll be wondering why they're always doing this kind of thing. Another one is they don't like to play with anybody. They stay on their own, they have the world of their own, they just stay on their own, they don't play with other children. Normally children, when they see other children, they get excited and they want to play with them. Maybe they drag each other and they want to play with each other, but for them they don't really play with anybody, they just stay on their own. So now what do you do when you notice all the signs? Please, when you notice all the signs, you bring the child to the hospital so that for us to assess and know where the problem is, and also start therapy on time. For the aim of managing them is to ensure they have a quality life and also to support them to get the skills. So we have a lot of therapists that are involved in their management. We have occupational therapists, they will have the speech therapists, will help them with the speech. We have also the behavioral therapists. We have an educationist, because they have to go to special school, so they have to get support in school. And also even for other ones, ENT surgeons, to assess the ear and know if there's any problem. So it's a multidisciplinary approach for them. So you need to involve a team of therapists for their management. Sometimes we give drugs, but the drug is not really it's not to treat the autism. But what the drug does is just to try to manage some of the behaviors they have, like aggressive behavior, or maybe they are not sleeping well, or they are not having seizure, anxiety they normally manifest. So these are when we now bring in drugs. The drugs is not to treat the autism itself, it's just for all these things that they can also have. So we're able to learn about autism, how to identify the signs, and what to do when we know that or notice that our child has autism. Thank you very much. See you for a subsequent discussion. Bye bye.